Hi friends, I bring you greetings from the University of Plymouth where I am the second year PhD student and also from Manipal University College, Malaysia where I am the professor and head of prosthodontics. On behalf of my supervisors from University of Plymouth, I, Dr. Prashanti, am delighted to present this topic today on this virtual platform, using a systematic review to develop a taxonomy of uncertainties in healthcare to structure the design of future participatory research. We all agree that uncertainties are intricately and inevitably interwoven into healthcare professions, and dentistry is no exception. As a clinician from the past 20 years, I have been battling with uncertainties every single day, right from the diagnosis to treatment plan to predicting the prognosis of a disease. But we should not forget that on the other end of this healthcare uncertainties is the patient, and the patients too undergo the uncertainty related anxiety. Every single person perceives uncertainties in different ways, and based on their tolerance levels, they are either aversive to it or they are adaptive to it. And uncertainty can even become more pronounced for public and global health scenarios as the COVID 19 pandemic has made painfully obvious. So, during this time of the pandemic, our research team wanted to study how people perceive and respond to uncertain situations and what is the impact on shared decision making process. And this question we wanted to ask for oral health uncertainties, and because literature is lacking in this particular area. Now, we formulated a research question: how do patients and dentists perceive and respond to uncertainties in oral health decisions? But before even we embarked onto this process, we wanted to ask a more fundamental question: what are the different types of uncertainty in healthcare? Now, when we looked into the literature, looking at the existing taxonomies or models of uncertainties, yes, there are models and classifications given in literature. However, these current models mainly focus on clinical decision making within a restricted healthcare system context. And also, they have classified uncertainty in a discrete and segmented manner, and the overlap or the dynamic interaction which happens with the uncertainties at different levels has not been discussed. Because of this reason, we wanted to conduct a systematic review and to develop a comprehensive model of uncertainty in healthcare. So we looked at different databases and we came through 4,145 articles and two different authors independently and in duplicate. We screened it, and keeping our inclusion and exclusion criteria in mind, we came to 33 included studies in this systematic review. Now, we classified the articles which we found in our search into three different categories. That is, studies which were looking at models and taxonomies which were identified from the literature, which were 13 in number, and studies which were describing models and taxonomy of uncertainties through primary research or empirical research, which were 15 in number, and those which were classifying from case studies were 5 in number, and all these were included in our systematic review. Now, we had to take a call what type of synthesis we are going to undertake. Is it a framework analysis or the framework synthesis, where we are going to have one framework or the model which is already there in literature and compare our data to it? Or are we going to do a thematic synthesis where we are going to inductively develop the codes and the themes? Or are we going to have more of a descriptive way in which we are going to deal with the data through the narrative synthesis? So after discussion among the co-authors, we came to a conclusion that those which were identified from literature and classifying uncertainties, we would look at it more descriptively and give a narrative synthesis of that. However, those which we identified from empirical research and the case studies, we will do a thematic synthesis. So the articles which were identified from the literature, that is looking at classifications from literature, were classified into 7 major concepts of uncertainties, as you can see in this picture: knowledge related, system related, unpredictability, depending on the quality of information, patient experiences, clinical related, as well as the relationship related uncertainties. Then we went ahead with the thematic synthesis of the rest of the studies, and we used the Thomas and Harden method for this, wherein we had the key article and the codes were identified from the findings as well as the discussion for the primary research, and the entire text was used in case of case studies. And we developed these descriptive themes which were close to the primary studies, that is what is identified from the articles, and we came with the analytical themes, which were representation of a stage where interpretation goes beyond the primary research, and we gave new interpretive constructs. Coding was done primarily by me. However, two other authors from the different backgrounds, they also coded a sample of 6 studies each so that we gain a broader understanding of the issue and also increase the reflexivity. Now you can see that the similarity of the codes between the 3 authors was almost similar. However, the descriptive and the analytical themes were discussed among the authors, and finally, we arranged the 77 codes from the 20 articles in 26 descriptive themes and 11 analytical themes. We developed an independent and interdependent multi-level conceptual model of uncertainties in healthcare, and we arrange them into 3 levels, that is the macro, meso, and the micro levels. So this is the conceptual model which we developed, where the macro related to more of communities and society as a whole. So the global public health and healthcare system uncertainties were classified here. Meso pertained to the physician interactions, networking. So we had the clinical, relational, and knowledge exchange type of uncertainties, and micro related to more of the personal, individual values and beliefs. So the personal uncertainties were categorized here. Apart from this, the other 4, that is the epistemic related to knowledge, allotric related to the predictability, parametric related to the models, and ethical related to the ethical dilemmas, were categorized into all the 3 levels, and I had an overlap. Now, we gave the conceptual model for informal testing for patient and public. And this is an example of a female patient who was 35-year-old who had these fertility issues, and how she underwent different kinds of uncertainties during these process was explained. So when we looked at this, she underwent both the clinical uncertainties, personal uncertainties, and also unpredictability, that is the allotric uncertainty. And because the doctors or the families did not comprehend how the patient was feeling, the mental support was not there, she also underwent the uncertainty which is related to the relations, that is the relational uncertainty. Once she conceived and she did not have any information on how to do the breastfeeding, she underwent the epistemic uncertainties and the healthcare system uncertainties. So what I want to highlight here is that even though the uncertainty is being experienced by a single person, there is an overlap of different layers of uncertainties which we can see in this particular situation. So what insights we got from this particular exercise and this systematic review is that patient involvement made us appreciate the dynamic interaction of one uncertainty with another in a given situation as experienced by the participants. It also demonstrated to us that smaller clinical decisions that only affect one person can have multiple layers of uncertainty affecting those decisions. Now, this review also raised a question whether conceptualizing these elements as separate, isolated issues is useful, or should we consider them as dynamic items which can change over time in different contexts and also for the same decisions. Now, this insights gave us an idea as to how we need to proceed with the rest of the research, what type of research methodology we need to use, what is the method we need to use. So we came to a conclusion that to answer this research question, we need to engage the participants in more of an immersive environment where they are participating in the process of research. The participants are exposed to the multiple layers of these uncertainties. Now, what is a participatory research method? It is a term used for the systematic inquiry in direct collaboration with those affected by the issue, and also it is incorporating the end users of the process into the research process. So we designed this unique 10 participatory toolkit, which had different processes which the participants had to undergo. And you can see here that we had a photo elicitation method. We took the patients around a simulated dental setup and they clicked photographs identifying the different uncertainties which they are feeling in that environment. They explained about those uncertainties which made us aware of how they felt in this dental environment, and also they mapped these uncertainties in different layers in the grid, as you can see here, telling us how much impact it had on their decision making. We know that systematic reviews are used to resolve conflicting evidence. We know that they are used to support practice. We also know that they are used to identify gaps and need for future research. The interesting aspect of this research project is the systematic reviews actually gave us more insight into what is the methodology and the method we want to use for this primary research. Instead of interviews where a single participant who is unrelated to the environment is seated and we interview them regarding uncertainties in healthcare, we took the participants into the environment in an immersive manner. We tried to explore the different uncertainties so that that dynamic interaction which happens between uncertainties can be explored. We also can use this systematic review conceptual model as a framework for analyzing the results. So this model which we developed can act as a framework for the data which we are going to collect through the participatory research, and that is what we obtained from this systematic review. So not only for the use of identifying gaps, this systematic review is useful for designing your methodology, the methods, as well as the analysis stage. It is giving you some kind of insights. So, in conclusion, I would like to say that our systematic review has contributed to the development of new expanded taxonomy and model of uncertainty in healthcare decisions that reflects our current transition from more didactic to more participatory decision making process across different levels of the healthcare systems. Our systematic review was able to deconstruct the different layers of uncertainties, and it gave us insights into planning a future research which was more meaningful in engaging participants in a participatory research method and exploring the different layers of uncertainty and the dynamic interaction between them. Thank you very much.